My pleasure to introduce fellow Rotarian Denise Robinson. Many of us know her. We also agree that we don't get to see her often enough. But you know that being the CEO of Alvis is an incredibly huge job in itself. I skimmed through her resume, which, wow, is amazing. And here's a couple of quick things here. She has multiple awards from the American Correctional Association, awards for excellence in community corrections from the Ohio Department of Rehabilitation. She's president-elect of the ACA, chair of the Community Corrections Network, International Corrections and Prisons Association, and past president. More. She's on the board of Homeport Reed Avenue Center and Life Care Alliance. Got a Presidential Lifetime Achievement Award for service from President Obama. Holy moly. No wonder we don't see her often enough, but is there anybody out in our community doing better, greater service? So, quick overview of Albus up to date. Denise spoke to us last before COVID, and that was a really good reminder of the evolution of Albus, so we'll get a bit of that. What was it like providing service, and still probably, during COVID? And then a big expansion announcement about Albus. So, Denise.
Thank you. Good morning. Oh, oops, sorry.
Excuse me.
Good afternoon.
Good afternoon. I have a clock issue. I can never tell you what time it is for real. That's true. That's true. So I'm going to use my iPad. And Gloria's going to advance my slides for me, right?
Yes.
Thank you. Thank you, Rick, for having me again and for that wonderful introduction. And thank you, Scott, for having me again. And Amanda, you are funny. I need you to come do some stuff for us. I really do. I'm delighted to be here, and to my fellow Rotarians, I'm really excited to be here again. I always love to talk about Alvis. I think it's the best thing since sliced bread, and really saving a lot of lives. And so I'm going to go through these slides. There is a lot of slides, but I'm going to be quick because I know we're on a time schedule. So just to remind for those of you that were or were not here last time, that we were established in 1967. We're a very large human services organization. We're one of the top 10 largest nonprofits in our city, besides hospitals. I don't put us with hospitals, but we started as one house, and then we operated about today in about 40 locations around the state of Ohio. We're in Columbus, Dayton, Chillicothe, Lima, and Toledo. And every treatment program that we service and our support system provided Alvis, we've had the same objective since 1967, and that is to turn lives around 180 degrees. Our vision is a community that believes a person's potential is more important than their past. Our mission is to innovate and deliver evidence-based human services programs and empower those we serve to lead successful and productive lives. I invite you just to take a minute at your, and we'll get some stuff out to you to look at our vision and our mission. It's really, really important to us. It really attaches to what we do. We need you. We need each and every one of you here as a member of our community to believe that a person's potential is more important than their past. So I always say we need you to most people we talk to. We have grown tremendously. And it's kind of like a blur. And you can see that we adapt to meet the needs of all of our community's most vulnerable citizens, and with effective, evidence-informed, and cost-effective programs. We really try to keep the cost down, but we really try to meet everyone's needs. You know, we began with servicing men that were coming from the Ohio Penitentiary, and then in 1981, we expanded to serve individuals with developmental disabilities that were offenders or were at risk of offending. And I first came to Albus and worked in our DD programs, and a really, really different population. There's two things that I learned from doing that that I've carried forward through my employment with Albus, and that was working with DD clients. I saw the importance of doing assessments and assessment-based individualized treatment. That is something I gained from that population, and I feel like we have to do that every day. I work to ensure that every client that walked through our doors had an individualized plan, and that was incorporated into evidence-informed programs and services. I made sure that we were audit ready every day. Because of a bad experience I had, when I walked in the door, I was asked to write progress reports for clients that had been with us for several years, and George was on our board at the time. And it was really interesting because I was asked to do progress reports for April, May, and June. I started the organization in July. So I was like, sorry, can't do that. But, so they were a little angry with me, but that's when I realized people just can't, you just can't ignore the people that are placed in our care. We have to continue to do the right services. That made me driven to meet treatment needs of everyone that's entrusted to our care. And so I became the CEO in 2005. Our budget was $7 million. Today it's almost $35 million. So you can see the progression in the slide of how much we've grown. And not to say that I did that, but what it is there's so many people with needs, and we had to take a stand, and we had to provide services. We had to ignore the misconceptions that people that are involved in the criminal justice system are dirt or that they are not people. And so it took a lot to expel that. So we have 5 lines of services. Individuals that have been involved in the criminal justice system, I talked about that. I talked about the clients that have developmental disabilities, but I also want to talk about people that need a job. Workforce development is huge in our organization, and we need to make sure that they have livable wage jobs, not just a job. And then individuals in need of behavioral health care, treatment services like substance abuse and mental health and trauma. A lot of our females come with a lot of trauma from their backgrounds. And then something that makes me smile really big, and that's working with our kids and our families. Our kids didn't ask to be where they are, and so we have to take care of the kids. If you look at any piece of research, you'll see that if you work with the kids too, then the client that you're working with is going to be much more successful because of that. So I love our lines of services. What does a typical Albus client look like? I just want to talk about statistics. I am a data fanatic, and this one right here will make sure that I have any data that I need. She's like an encyclopedia, really, seriously. But I have to say this because it's really, really impactful. Every 25 seconds, someone is arrested for drug possession. Every 25 seconds. That's like right now. Nearly 1 in 3 adults has a criminal record. Really? So if I count in this room, no, I'm kidding. A record of 93,000 people, more than 250 a day, died of a drug overdose in 2020. 250 people a day died of a drug overdose in 1 year. We lost a client over the weekend that died of an overdose. 65% of incarcerated people have an active substance use disorder, and then another 20% were under the influence of drugs or alcohol when they committed their crime. 44% of individuals in jails and 37% of state and federal prisoners have been diagnosed with a mental health disorder. More than 7 million citizens have an intellectual or developmental disability. The people served by Alvis are in every neighborhood and every community. So this next slide is a ball. We use this ball. This ball is a tool that we use to facilitate getting to know you conversations between parents and their children. Now, just think about it. Our kids haven't seen their moms or their dads for many, many years. So they have to get to know them. They throw this ball, and you can see what's really present is what do you want to be when you grow up? And that question, why do you ask that question? Because no one ever wants to be an offender. Nobody sets their sights in the future that I want to be addicted to drugs. It's just not the thing. So it's really nice to be able to throw that ball and find out, what do you want to be when you grow up? The lives of individuals we serve at Alvis are, they haven't gone according to their plans when they were young. If they threw that ball, I bet their response was not where they ended up. So creating our family and children's program, that's why it was so important for us to do that. When a parent is ripped away from a family, then what's left behind is that child. I personally felt that we had to do something. And so we developed a program for our families and children, because I've always had this opinion that Alvis was supposed to serve everyone that came through our doors. I didn't care what their issue was. It was just that we had to serve it, because so many other organizations in Columbus, we work really closely with a lot of nonprofits, but so many people would call me and say, I have one of yours. What do you mean you have one of mine? I'm sorry. Well, did they come to you for services? How about providing some? But no, that wasn't always the case. And so I said, okay, so we'll create this program. I use this saying, it's like a stone thrown in a pond, that the effects of a person's incarceration is like ripples, like ripples outward into their families, into communities, and the shame, the trauma our kids are experiencing. They have low education rates when they're going through school and those kinds of things. So we want to make sure our kids are taken care of. More than 7 million children in the United States has a parent involved in the criminal justice system. Really, 7 million. And then 8.7 million children live in households where at least one parent has a substance use disorder. It's staggering numbers. So, our hope is that their future is going to be one that they are with their parents and they're able to matriculate in school. They're able to do the things that most people do. And so our family focused programs are just that, just to make sure and to ensure that our kids are going to be okay for tomorrow. Our kids are our tomorrow. Our kids are the ones that hopefully will sit here one day, that will sit in other venues one day. So we have 3 pillars, and that is, we talk about their parenting and education. We take care of our clients, of the kids. If they need treatment, if they need psychological treatment, they all do. They've all been through some trauma. So I'm going to move on, but the next slide is just some pictures of our family and children's program, because I love it. And it's just, I don't know, when you look at it, you don't think about what the kids are actually going through. It looks very happy, but this happiness is because they went through their program. That's the only reason it's happy. I have to tell you a quick story. How am I on time? I'm good. I have to tell you a quick story. So during this program, there was every year pre-COVID, we would have a program where the kids could come in and they would meet with their moms, and they would each family, because caretakers, everyone would be there, each family sat at individual tables. And they worked on crafts, and they made picture frames, and they would do this every other Saturday. And this little boy, he sticks in my mind. I get a little teary when I think about it, because I didn't grow up like that, and when you see it, it's like you think sometimes, I'm old enough now to realize that's not, everyone doesn't grow up the same way. But Santa walked through the door and he screeched and he was standing right by me, and I was like, whoa. He grabbed my leg, and he didn't know his mom well enough to run to mom first. He grabbed my leg, and I was like, okay. And it's Santa. He started hyperventilating. It was Santa. And so we finally, his mom and I finally calmed him down, and then he went and sat on Santa's lap. Santa had toys from his list that we had them generate. They had everything on his list. Thanks to MI Homes and some others that make sure that our clients' kids have Christmas. And I'll never forget him, because now he's with his mom. His mom works every day. She's not a client, She's substance free. This is years ago. At least, what, 4 years ago? And so it works. Alvis works. It just works. Then I want to switch to workforce development real quick because, as I said earlier, it is extremely important to get people livable wage jobs, or they'll turn back to raising money or making money illegally, and that's what we don't want to happen. We teach soft skills, we teach hard skills. We more recently, in the last 2 or 3 years, we do really hard skills training like CDL licenses. There is, I can't tell you how many jobs there are for CDL drivers. And our clients are starting off making $60,000, $70,000, $80,000 a year, which is great. That's what we want to happen. We want them to be able to take care of themselves and take care of their families. So, and then we also want our clients to get jobs where they have benefits. And again, it's just great to make sure that you can keep those families together too. Our workforce development keeps people off of public assistance, where a lot of our women have been involved. And so I just like to talk about that. So I'm going to skip to, that one. So this is just a slide that talks about, people are talking about how excited they are. And you can see Amanda, she just graduated. And it was, just to show that picture and her elation for graduating. Down here with the mayor is a client that completed one of our workforce development programs. And then Jesus is a great story. He spoke at our groundbreaking for our new project that I'll talk about in 1 second. But he spoke at our groundbreaking and was invited into the prisons to talk with inmates from the director of corrections, because he was so well spoken, number one, but the biggest thing is that the dollars that we receive from the Ohio Department of Rehabilitation and Corrections works. He's an example. He was in and out of prison several times, and he said it very openly, but until I came to Albus, I will never go back now. And it's been years too. And it's because of those evidence-informed programs. Don't do programs that aren't based on research. If you do, you're wasting our time. So I believe, and that is why I feel like as the CEO, I have to ensure that everyone that comes through our doors. And so I give you a great statistic. I may have said this last time. 79% of everyone that completes our program is still successful. And it's after 3 years, not one. It's greater than the national average. It's greater than anyone in the state of Ohio. We aim to put out people and it's because it's based on research. That's the only way to explain it. And then sometimes people always ask me, well, what do you call them? Former offenders, inmates, restored citizens. I hate all those references. Recovering addicts. Why? How about people? How about that? How about that? They're people. And I bet there's nobody in here that doesn't know someone that hasn't been involved or has an addiction. And I can tell you, the people that I hear from, you would be surprised. And I will. And I said earlier, we need you. And when I say that, if you know someone and they don't want to be identified, I get this all the time. I get direct calls to me saying, my daughter is addicted. Can you help her? Yes, I can. And nobody needs to know that. Nobody needs to know that. Bring your daughter here. Nobody needs to know that. We have to support that, because that's getting people help. That's what we do. So to quickly talk about COVID. I don't want to spend a lot of time on that, but I was forced to by Rick. So I'm going to talk about it just a little bit. And COVID's been tough for us. It was really easy in the beginning. It was really easy. Our crisis plan, which we've had for, as long as I've been at Albus, and I've been here 37 years, and I was 12 when I started. Keep that in mind. However, we had a crisis plan and included a pandemic. So we were prepared. We had PPE. We had everything, and we were awesome. I mean, we had things in place. We had a crisis team that met every day. I put out daily messages to the staff, keeping their heads up. And now I do it once a week. But those are things that we were all ready and prepared for. We were not prepared for the length. We were not prepared for the length of time that COVID has been here and still here. And so, it's been tough. And it's been tough on our staff. It's been tough on our clients because I had to stop visitations. I can't have people going home to where people are not vaccinated, and I can't have people going out to other places besides their employment. So the things that we let them do is employment and treatment, and that is it. And so we kind of been in that lockdown stage. So it's been really hard. So if anybody has any suggestions, here I am. Please tell me. But we really wanted to support the staff too, because it was really difficult for our staff, really difficult. And now, because of the federal government, we're under a federal vaccine mandate. We got a little reprieve. It was supposed to be December the 4th, I think it was, but now we're in January 14th, and hopefully we'll get another one. We're just praying for that, because out of my 500 and plus staff, I've only got 270 that are vaccinated. So it's been tough. It's been really tough. And I'm fully vaccinated and boosted. So if you get next to me, I'm good. So we did a lot of stuff. We know that we posted the Heroes Work Here signs all over the place. And we've had some special events. We had drive-through Staff Appreciation Day, where they drive through, they get some prizes, they get food, take pictures, those kinds of things. It really helped with staff. So what's next? We have embarked on a capital campaign. We're building a $25 million expansion. Yeah. I didn't say that out loud, did I? Because sometimes that's scary. But actually, we did really, really well. And, the powers that be, the city, the county, the ABC corporations have been amazing to us. Because we started out when old Victorian homes that were not made, that's one of them, that was made, not made for, commercial. We have 30 women that live in that house, 30 women. And so the cost of that upkeep, they're about 100 years old, but we've had them since the late 60s. And the upkeep is just killing us. And then we have 3 of those on Bryden Road. And then we also have a whole floor at the downtown YMCA. I'm sure you all read that the YMCA is closing. And so we literally were forced into doing this. And I'm glad we are, because it's something that we need to do. We will save about, in efficiencies and combining, we'll save about $400,000 a year. Just by doing that, and that will, of course, will go back into treatment. So I'm really excited about that. Next one is some pictures of what it looks like. We have an existing 100-bed facility we're adding on to, and then we're going to, as soon as the men move out of there, we're going to renovate the 100-bed that's the existing, and we're going to put, we're making it more female conducive, and they have all separate dining rooms, separate everything. They don't cross. We do have a couple of co-ed facilities, one in Toledo and one in Lima, and it is not fun having the men and women. When there's a will, there's a way. That's what I would say, So yeah, well, our capacity will go from 100 on that site to 350. Beds, and so it's a nice location. Primary One Health will be there too to provide health care and those kinds of things. So that's just some of the slides about the expansion and renovation. 5 facilities, we're going to go down to 2, 18,000 square feet to 54,000 square feet. It's actually 100 residents to 350, and then we'll have more counseling space too, and workforce development places for too. And again, we're going to save $400,000. This is the inside, and it's gorgeous. And that's something too that's really bothersome when some people say, "Why would you have such a nice place for those people?" I'm sorry. We opened up an outpatient drug center, and it was a doctor's office. We gutted it, and this is about 4 years ago. And the Columbus Foundation and the city were really helpful in that process. And that's what we heard a lot of, is this place is amazing. Why for those people? So people don't get it, and that's why I'm so happy that you asked me here again today, because I know you all get it, and so I'm able to talk to people that get it. And because people are people make mistakes. I know I've made some mistakes, maybe not as serious to be in prison anywhere, and I'm sure everyone in here is not mistake free. And but if you go to the doctor's office, don't you want to be in a nice place? When I go to the doctor's office, my doctor's office is nice. How come they can't go to a nice place? So anyway, I'll get off my soapbox, but because it is. But I need your help one more time, and I just want to conclude by saying that I want you to be part of turning lives around. It's the holiday season. This is the toughest time for our clients, the hardest time. We have a holiday wishes. Every family was adopted, as they have been over the years. And so every child will have presents, everyone, but our parents experience trauma really bad around the holidays. Also, those that are in addiction, that's when they want to use. So that's what I need your help with. If you know someone that needs us, let us know. We will do it. If you know someone that's hiring in positions, let us know. If you want something to be kept confidential, reach out directly to me, and I will take care of whoever it is. I want to thank you again for having me. Follow us on social media. We are on Facebook, LinkedIn, Instagram, Twitter, YouTube, you name it, we're there. And so, but I thank you for inviting me. This is my passion project, so thank you. I'm sorry. I forgot, sorry. Yeah, go ahead.
I have a question. Yes. My sister was a social worker at Rikers Island. And I said to her, what can the average person do to make the lives better for these people? And the first thing she said was books. She goes, they have a lot of free time. They can sit around and they can read books. And they probably need education like we all do, and greeting cards so they can connect with their families. Okay. Fast forward, not quite into COVID, I don't think, but I had a friend who died and she had all these books. And she had these greeting cards. So another friend had the same situation, and we said, well, let's give them to the prisons. And they said they wouldn't take them. Part of that prison system or not?
We're private. We are private. We get funding from the prison system, but give them to us.
The prisons
Because
won't take
that's
them
not
because you can
known.
hide stuff in the books.
Right.
The prisons only take things from Amazon.
And
Well, now they probably do, but they used to take.
Yeah, but
Yeah.
now they won't.
Well, what
And
about greeting cards?
we'll take those too.
Okay, but I mean, like
You can spray like liquid drugs on greeting
Yeah.
cards.
liquid drugs, really.
That's what I was going to say. I'm glad you brought it up, because that's the big thing now.
This is an interesting thing, because I'd never heard about
They
that.
soak
Liquid drugs.
the letters. In fact, now they have, these machines are like over $1 million in the prisons, but they have to scan the letters that they get from family and destroy the actual letter, because they soak them in drugs now, and they can just break off a piece of the paper.
Okay, well, that's a reason. I could not understand why they wouldn't do that. Also,
And the reason why I said like this, because George will tell you, George brings us books
I will. I'll
for
start
20-something
collecting
years,
again.
hasn't it been?
Yeah, I just brought some,
The other day.
I don't know, the other day.
Yeah. So,
No,
yeah.
anyway. Okay, second thing is we're working with a school in Linden. My daughter-in-law is one of the pre-K teachers there. There's a lot of trauma when people come out of prison back to families.
Yes.
And then she sees it in her
Yes.
classrooms. Is there a way or something that you could work with the school, with Windsor Elementary, and help those families get through that process?
So we have Columbus City Schools has reached out to us numerous times, but it's been more individual. Like there's like a school, like Windsor maybe, where they reach out and say, I got a kid and I know something's wrong. And then I found out that their mother was in prison. Can you do something? So we do things like that. We've been working internally with Columbus Schools. There's also issues in Whitehall. There was issues in, almost every school. You just can't. So we're working on something more long-term, strategically, trying to look at how we can do that. There are some organizations that are doing some things with the kids, with parents, and I Know I Can is one of those. And then there's a couple of more that are actually doing some good work.
Would you come and talk
I
with
would,
our
absolutely.
kids?
Absolutely.
If we could get you connected?
Absolutely.
But do we have to go through Columbus City Schools? Because that's like Michigan. It's
know.
like crazy.
I don't.
Yeah, let's be direct.
More questions. More questions.
Yes, sir.
There are several national foundations that are around to help employers who want to hire people coming out of the prison system. Could you comment on which of those foundations you work with and which ones you'd recommend?
So, oh gosh, you asked me too fast, but we do have a list of those. Help me out here.
One's called Dave's Killer Bread Foundation.
Yes, I heard it. I just recently heard about that. And then there's, oh gosh, it's like Prison Fellowship Foundation. There's that one. There is, it's a family. There's a family foundation out of Chicago that does some work. The name is escaping me right now, though. But yeah, there are several. Yeah. Yes.
Your cover is blown now because we know that you're actually an angel in disguise. But my question for you is that graph is only more awesome when you figure that those kind of things don't happen without people. Where do you find lieutenant angels to help?
Yeah, that's been tough more recently. But before it wasn't an issue because, I say, well, if you come to Albus, you should come because of a career, not a job. And there's so many people that have a heart for the work because people have been discarded so much. But right now it's really tough. I'm down 120 positions right now. And we all are trained now. We just recently got trained so that we can go in and provide coverage for entry-level positions. It's really tough right now, as it is all over the country, and it's very tough. Yes, sir.
How is Alvis funded?
So about $13 million of our dollars come from the Ohio Department of Rehab and Corrections. Another $6 million comes from the Federal Bureau of Prisons, Department of Justice. Medicaid is a huge funder. And then workforce development, city, county, we get those dollars from city and county also. We are United Way, and then a lot of foundations and philanthropic types of outreach that we've done. Mm-hmm. Yes, sir.
I guess, again, with our work with Windsor School, do you have any sense of what a big school system like Columbus should be doing to keep kids from winding up in prison, I guess, and then ameliorating the whole situation? And, the City of Columbus gets more money per student than a lot of other systems. Do they need more? Any sense of how much more they need and what they should do with it?
I just feel that there is not a strategic focus for that, and I'm a person that's how I thrive on strategy, and like I said before, on data. So there's enough data that shows that you need something has to be done, but I feel like the strategy is not there. The strategy is not there, and they're trying to focus, I think, on those that can, versus those that have, an issue. So that's just how I see it. But I think that, to me, I'm the outsider looking in, and I do look at things like Columbus Public Schools, Columbus City Schools, I'm sorry, I need to quit saying that, but I do look at budgets. I look at everybody's budget because I'm like, okay, they could squeeze a couple of dollars here for each student, and then we'd be able to do this, this, and this. And I do think that that's the way to make change. Yes, sir.
You talked about CDLs, and commercial driver's licenses have federal standards, is it true that a person that's a convicted felon can't get a CDL? That's not true.
Totally false.
Is there a misconception about that?
Oh yeah, oh yeah, absolutely. I mean, we push our clients to get that certification because that's one of those certifications that doesn't have these barriers. So yeah, absolutely. Now there may be something that if you're I don't know, if you had a theft, they may not want you transporting their stuff that you can take. You know,
It's not a blanket condition.
it's not a blanket condition, but I would say 80% of the people can.
Oh yeah, and we should probably wrap it up. But just, last question, and it's mine. You mentioned, that you need help and you need people to volunteer. What are the volunteer opportunities besides, books and greeting cards? What else can we do?
Tracy. Tracy supervises our volunteer coordinator. So we do right now, because of COVID, things are tight and we're not allowing a lot of people in. But right now, Tracy's had projects with like MI and Nationwide and all those where they come in and paint. They've put appliques in our women that have been involved in human trafficking and our women that are addicted. Some other things.
One thing we did Saturday was a Zoom with a vision board event where a philanthropic group Zoomed with about 30 of our clients, I would say. I don't know how to do a breakout room in Zoom, but other than that, it went really well. But yeah, so we get them, they paid for the supplies, and then we've gone through the exercise where they can, kind of map out their future. What do they want 2022 to look like? We get a lot of greeting cards. This past Saturday, while we were doing the Zoom, another organization, we have a children's reading garden at our Amethyst office. So they went there and did some reading. There's different opportunities, but a lot of it is virtual right now.
And when we do open back up, whenever we do, I mean, we need everything. Teachers, religions, it's just a lot of things that people can do as groups. So thank you again.
Excellent. That was awesome. Thank you, Denise. These are kind of my final thoughts after listening to Denise talk. Denise mentioned there's so many people with needs in the community, and when we were talking about Sanctuary Night, Sally had emailed me and said, if we don't take care of these people, who will? And I think it's so important because that is such an important thought, because as Rotarians, it's our responsibility to take care of people in our community, but it's also our privilege. Like, how lucky are we that we are in a position where we're able to do this? Denise mentioned people don't, when you ask kids what they want to be when they grow up, no one says, I want to be incarcerated, I want to be an addict, I want to be, we're looking at Sanctuary Night, I want to be a sex worker. So we're so fortunate that we have the privilege of helping out these people. So, I like to keep that in mind when we're doing these projects, because we're just so lucky to get to help. And that's it. We'll end 3 minutes early. Have a great day. See you guys next week.